So here is another vlog on the cheerful topic of ovarian cancer. I was going into the cancer hospital and I armed myself with the latest information about ovarian cancer, lots of leaflets that I got from an ovarian cancer charity day. And I breezed in dressed from head to toe in teal, which is the ovarian cancer colour, if you didn't know, and found an information stand. This was 3 tiers on 3 sides, and it was fully stacked with flyers. And so I had a look at these and to check them out. And here I present my findings with the help of my delectable assistant who wishes to remain anonymous. These were the leaflets that I found. This one is a club for people with advanced prostate cancer. 1. 2. A walking group in Beckenham Place Park for people with prostate cancer and their families. Art classes for anyone with prostate cancer. 3. 4. Brother to brother, man to man, support group for black men with prostate cancer so they can talk to each other. 5. Prostate cancer support group. Well, pretty much says it all. Prostate Life. This is a discussion group for anyone with prostate cancer. That is number 6. Number 7. Qigong, breathing and meditation, movement exercises, just movement actually, for anyone with prostate cancer. 7. This is a group for men on hormone therapy who have advanced prostate cancer, and it's about it shows a number of things that you can do that they provide: exercise sessions, art courses, day trips, information seminars, walking groups, afternoon at the movies, that sounds good, and relaxation classes. Again for prostate cancer. And along with these, there were a number of booklets. These were from Prostate Cancer UK. There were 6 or 7 of these. I won't show you them all, ranging from like 18 pages to 72 pages. But did I find, can you pass me anything that got anything to do with ovarian cancer? Assistant? No, she cannot. Or breast cancer? Or in fact any other cancer. So this leaflet, this stand, was completely devoted to prostate cancer. Having found this out, I thought, well, I better not put ovarian cancer leaflets on it, and I went to reception and said, is there anywhere I can leave these information leaflets about ovarian cancer? Maybe on this stand, or is the stand solely for prostate cancer information? And she said, oh, I think it's just for prostate cancer. So I said, well, is there another information stand then for any of the other cancers? No. And when I asked where I could put the leaflet, she indicated a small table that was almost completely hidden behind the check-in kiosk and next to the reception desk. Or even if you could just about see the leaflets, you wouldn't have been able to pick any up. So I rejected that idea, and she said, I'll go and knock on the door and find out what the nurses say. So I did this, and a nurse came out, and I said, I've got these leaflets, where can I put them? And she said, can I put them on that stand? She said, oh, is that just for prostate cancer? She said, oh yeah, I don't think you can put them there. You can put them, you can lie them on one of the tables in the waiting room. And that was the only option, which is what I did in the end. But although it's quite funny that all these groups for prostate cancer exist, it's also indicative of how the profile that prostate cancer has and the importance that we give to it over any women's cancers. even though its survival statistics are so much greater than women with ovarian cancer. And maybe that's partly it. Maybe they think, oh, it's not worth doing anything with ovarian cancer sufferers because they're just going to die. They're not going to be around long enough to finish a painting in the art class or whatever. And then the other thing about these leaflets is that, and these groups, is that mostly they're organised by this hospital's charity. So they're not even, I mean, the booklets were from Prostate Cancer UK, but all the other groups are actually organised by the hospital, which, as far as I know, has organised nothing at all for women with ovarian cancer. Anyway, thank you for watching. I'll sign off now, and let me know if you've found the same thing at your hospital.